So I'm Dr. Jon Williams. I'm one of the surgical doctors here at Clare House Surgical, and I see people in clinic and perform operations in our operating theatre here. So carpal tunnel syndrome is an unpleasant set of symptoms which is common and affects people's hands. It's caused when the median nerve, which is one of the main nerves supplying the hand, gets compressed within a space in the wrist called the carpal tunnel. The carpal tunnel is made up of the small bones of the hand, the carpal bones. The roof of the tunnel is made up of a ligament called the transverse carpal ligament. Running through the middle of the tunnel is the median nerve, and when this nerve gets squashed, patients experience symptoms. The symptoms of carpal tunnel syndrome are pain, numbness, pins and needles, and weakness in the hand. This normally affects the thumb, index, middle, and half of the ring finger. Management options include a splint, a steroid injection, and surgery. Sometimes your surgeon will recommend that you wear a splint. This acts to prevent you flexing your wrist, that is bending your wrist at night, and sometimes that can be quite effective, particularly in those who wake up in the night with pins and needles and tingling at that time. Steroid injection involves administering an anti-inflammatory into the wrist around the nerve. This reduces symptoms of carpal tunnel syndrome. Surgery for carpal tunnel syndrome is done under local anaesthetic. It involves some injections to the wrist, which make your hand go numb. We then make a small incision on the palm. This frees up the nerve. You'll then have some stitches, a dressing, and a sling to go home with. When considering surgery, it's important that you know the risks and benefits of the procedure. We'll go through a consent form with you before the operation.